All right. It is time for week 7. We're almost there. Um, I had just so that we make sure we understand the process. And Heather, chime in since you just did this. But I had someone from the last study group email me kind of worried about dates for the test. So back in the old days, when I took it 20 years ago, um, there were 4 times a year that they did the test. And so you picked one of those 4 times. That is no longer the case. Um, you'll get your email from the board that says you've been approved, but hold on. And then you'll get your email from ICNRC. Do you remember, Heather, how long it took you between the two? Maybe a week. Yeah, you're muted, just so you know. But yeah, I could read your lips.
Maybe a week. Yeah.
Yeah.
I can actually, if
Um,
you want to, I mean, I can pull up the emails if you want. I could double check for sure, but it
yeah,
wasn't,
no,
it wasn't a
I've heard,
month.
that's what I've heard, about a week.
Yeah, about a week, I think.
And then you click on the thing in that ICNRC and schedule your test. It really depends on what testing site you're closest to as far as what days they'll schedule it. Heather, yours is on a Sunday, right?
No, mine's on a Tuesday, but I'm doing it at home. They give you an
Oh,
option
okay.
to do it at home,
Right.
is what I selected to do. And there were tons of times,
Yeah.
like tons of options.
Even
I
if you
wanted
do it in the testing site, there'll still be lots of
I don't even
options.
know that that was one of the options. I don't know, maybe I had to select that, but I don't know that I don't remember seeing anything about doing it at a testing site.
Well, there is.
Yeah.
You might have just clicked.
Yeah, I must have just clicked that I wanted to do it at home and then it only gave me those options.
Yeah. Yeah, because there's like 15 or 20 options in all of Ohio.
Mhm.
So,
And
um,
it's when you first get it, it like the first dates that pop up are like within a week. And I kept having to advance the calendar because I wanted to wait until after I was done with this group.
sure. Yeah. Yeah. So this person was kind of freaking out because she's like, I gotta clear my schedule. And I'm like, you don't have to clear your schedule. You can do the test around what your schedule is. Um, so it was December 13th is when I had to do it because that was the December date, but you don't have to do it like that anymore. Um, so that's a nice thing. Um, and then also, I think we've talked about this, but I'm going to talk about it again. At the end of the exam, you'll get a screen that says preliminary pass or fail. It's going to be a pass. Um, it says preliminary because they have to send it to, all the checks and balances and everything. I have yet to hear anybody have it flip on them. So, I mean, it's possible. If the pass is 500 and you got a 499, it's possible. I will tell you though, somebody got a 498 and he um uh, peeled it, and they were like, sorry, we're not doing appeals. So they check it enough that they're confident with their score when you get the final email later. Um, so so be pretty confident in what you get when you finish the test. And then you send me an email and we have a little party online together. Um,
I think you might have gotten a question also, Jennifer, from Stacy on our end, and she's at a funeral today, so she's not going to be with
right,
us, but
right.
asking you about supervision for those of us that get to move to the, that get to take the S off the end of us. So um, can
You
you
mean
kind of
take
give
the
us
A off the end of you?
what did I say? A, sorry. Yeah, there
Yeah,
we
no,
go.
you're fine.
It was a question about supervision. And so, I went back to the standard because we've been working on credentialing for counseling and case management at our agency. And
Yeah.
I had not looked at the standard recently. Can you just speak to that for a minute?
was just talking with someone about that. All right, so these are the rules that changed in July. And know that there's lots of things. The board is trying to change everything, and I'll just say sometimes things slip. So this right here on the screen is the rule. So for the you are looking to be, you are an OCPSA looking to get the S. Okay, so you want to look at what the OCPSA rules are. So it says changes to those who provide supervision to an OCPSA to perform or engage in certain prevention activities, strategies, and activities. Okay. Planning and evaluation, community-based process, environmental strategies, and professional growth and responsibility must be supervised by an OCPS, OCPC, or a CHES. So if you're not doing those activities, then you can maintain previous supervision people. The problem is if you're applying for an S, you have to be doing all of those activities.
Mhm.
So you will have to have an S, a C, or a CHES sign off on it.
Okay.
Jennifer,
Yes, ma'am.
I was in a training with Andrea Huff a while back, and she said that there is a grace period on that we have until June 30th with like our current supervisors. Because like my current supervisor is an LISW.
So this is where it gets a little confusing, because for an OCPS, it does say that if you're supervised by an LISW or an RN, that you'll have a 1-year grace period. I'm not confident that that's going to count for people who are moving to an S. This is only listed by the board for people under an S.
Okay, thank you.
So, yeah. Now, if you want to get real technical, you could, because you have to have, what is it, 10 hours in every content area, a minimum of. So for these content areas, you have to have an S, a C, or a CHES supervising you. That's what, 40 hours? So you can have the other people supervising you up until you get these last 40 hours. That's the technical reading it as it's written. Which, could it be muddier? I don't know, but I will confirm, Nicole, but from what I've seen here, this is under the OCPS column. So I will check with Jill just to confirm, and I will have an answer for you guys by next week. But everything I've heard is that this is just for those who already have an OCPS certification. So question is, how the heck do we get that if we don't have somebody, right? I was just talking about this. There are people who are available for contract supervision. The cheapest I've seen anywhere is about $100 a month. Again, you would need that for these activities right here. So that might be 2-3 months.
The key
But-
part about this is too, though, that oversight of your program as a credentialed program, prevention program, has to be the LIS, the the licensed credentialed professionals, right? That we now are able to use. And so we, of course, just renewed contract with them and everything. So basically now they're not gonna be able to supervise any of us because we have several staff that are gonna stay just with the S on, or with the A on the end. And then there potentially will be 2 of us going up to the not having the S. So it's like these two contracted people, while I need to have at least one of them to oversee my agency services, because they have to make sure the program is operating, within the
Right.
scope of standards, they can't supervise us. So.
And yes, there's a difference
interesting.
between supervising the individual and supervising the agency. You're absolutely right.
Yeah.
Yeah.
Yeah. So obviously the, right hand and left hand. So a little
Karen,
frustrating. Yeah.
come on.
Yay. All right.
Oh,
Well,
yeah.
thank you.
So, yeah, I don't know if that answered any of that question at all, but that's what we've got.
No, I appreciate it. If you could, would you send that to me? Would you be willing to email that list right in front of you there? Because we're going to be having a site visit in January from OMAS for our programs. So I probably need to have an answer before then. So thank you.
Well, and I can also, oops, that's not it.
I said I would have that as well.
If you are able, it's now in the chat. If you're able to just download it from there. It's what was sent out to everybody back in July. But I know things fall through the email. I understand that. And they also just had to, so they had redid the RA form and had left LPCC at the bottom, so they just had to take that off. So sometimes things fall through the cracks, but yeah. So if that doesn't answer it, then well, we can figure out other things, but all right. So there's a little bit of disappointment. I'm going to tell you about it here in a second. It's not a bad thing, but for me, it's a disappointment. So we're going to talk about the communications toolkit, telling the coalition story, and then the coalition's part of the guide. In the past, up until a month ago, this communication toolkit was a interactive thing online. This is what I got this morning. Which I was very sad about. Now, we still have, and I have now put it in the folder, and we're going to go through it here together. We still have it in written form, and I've searched every which way. I then Googled it. It's no longer, I don't know if it's coming back, if something happened, but the interactive piece of it is no longer available. So we will go through this written one, and I did put it in the folder like this. It just made me sad because it was kind of fun to do. And I told you guys don't do it because we were going to go through it today, but literally within the last month and a half. But basically what this is it's a really good guide on things to think about when you're doing any kind of health promotion communication. And there's certain words and ways to look at things in here that are probably going to come up on test questions. So it's split into different parts. First, you have to analyze your situation. Kind of sounds like the first step of the spiff, right? Identify and understand your audience, kind of like your capacity, developing your message, planning, creating and implementing a communication strategy, implementation, and then evaluation. So again, knowing the spiff steps, it's like right here too. The one thing I will say is on the interactive, the links to all these worksheets weren't working. So I'm kind of glad that they put it this way too. But what it starts out with, you can read through all of this. But it starts out with analyzing your situation. How are we supposed to figure out what we're supposed to tell people? So when marijuana, recreational marijuana became legal, what were some of the messages we wanted to get out? You always have to do these 3 things. Make sure that you've got an understanding of the challenges. That's your assessment, figuring out what's going on in the community. What's your resources? Do we have, a coalition that's strong? Do we have funding? And then how communication efforts might support and align with your strategic prevention plan. So how are we going to get this message out? This does have a link. Look at that. Radola. I wonder if they're moving stuff. Karen?
Jennifer, could you make it just a tiny bit bigger?
Yeah.
I'm even though these are on my face, I don't see so well.
Well, and I've got it on a huge monitor over here. So
Yeah, so thank you.
yeah, no problem. So analyzing the problem. First thing we want to do. Who is affected by the issue or problem? So sometimes when we think of analyzing the problem, we just think, okay, we know the problem is, underage drinking. Well, how do we know that? And how do we know that that's happening here? So that's why they give you these questions to really dig into it. And they talk about, what kind of things to think about when you're looking at your capacity. I am really sad because it really was a cool, interactive thing. And then making sure that you align that with whatever your prevention strategy is. So let's say, if you remember, we talked about that tree with the roots. And if, let's say we get down to the roots and the problem really is that stores are selling to people underage. If your communication strategy is to reach parents, does that align with your strategy or your prevention strategy? No. Who would you want to then communicate with if that was your prevention strategy? If that was the root of your problem?
Store owners, salespeople.
Exactly. So just making sure all of those things align and are, connected with one another. Let's see if that helps too, maybe. So for this example, they've got the misuse or abuse of opioids, and their problem that they figured out was that 7.43% of high school students in 9th through 12th grade report past 30-day misuse of prescription opioids. So then they figure out, why is that happening here? And they realize it's access to prescription pain medication. So again, sending messages to, store owners is probably not going to impact this. So then they decide they want to increase safe use, storage, and disposal. So they decide they're going to connect with, they figured out probably that where these kids are getting it is parents and grandparents, because that's where most kids get, or most people get opioids that are being misused, is from friends and family. So they decide that they're going to target that. They do advertisements, publicity events, and PSAs. And then the hope is, for short term, adults get the information on safe use, storage, and disposal. Then that decreases access. Then that decreases the 30-day use. So again, the short term kind of matches up with the intervening variable. The intermediate is, no, I'm sorry. Short term is kind of the target towards the target group. They have it kind of funky here. Intermediate is intermediate available. And then long term is, what is your local root problem? Another one, just to kind of show you how they did it. This is underage drinking. In 2014, past 30-day use of alcohol among high school students in 3 communities was higher than the state average. So they looked at, why is that happening? High perceived ease of access to alcohol from commercial sources. So there's your stores among students. So the strategy that they're going to implement is responsible beverage service training. We're going to teach the people how to check IDs and make sure that they're doing that. Totally different kind of population and target. So this one is the alcohol establishments. So what are they going to do? They're going to do how many places are we going to establish? How many are we going to train? And then how many of those individuals at those places are we going to train? And again, looking at them in short-term, intermediate, and long-term goals. Let's see here. Yeah, make sure. Yeah, I'm going to skip over that. I'm trying to hit the highlights of what. Okay, this is one. Let's see if this will open. Oh, yes. Okay. So I do believe there will be at least questions that have this term in it, targets and agents of change. So the target is the specific person you're wanting to reach. So let's say for our example of underage kids drinking, the target would be the underage kids. The agents of change are those people who might be able to help you make that change. So the parents, the stores, anybody else that's kind of in that outside part. So let's see what they've got here. They had a really cute, I don't know why I'm telling you this because it's really sad that it's not there, but it was two pictures and I personally felt like they both looked like teenagers, but it was a teenager and a parent. And you had to pick which one you thought. So let me give you another example and see if you can figure out the differences. So let's say our problem is young people getting access to prescription medication from their friends and family. So who is the target for that? Who are we trying to reach and change the behavior of?
I would say it's a broad target, but I would say the people who are the owners of the medication, whether it be friends or family, how to keep their medication safe.
Okay. And then the agents of change, who might be some people around that might be able to help?
I would say pharmacists, doctors, other family members, caregivers.
Yeah.
Maybe those folks that have access to the disposal bags and the lock boxes.
I told you guys about my ENT who said just flush the medication, right? Prevention First has now sent them a big box of doTERRA bags. Yes, thank you. So the biggest thing I think with this is number one, you may have a question that might say agent of change. So now you know it's kind of the people around the target, whoever that target might be. I don't think there's going to be a question that says, is this person a target or an agent of change? But I just want you to know the words, the vocabulary, so that you can remember that. Identify and understand your audience. So how do we know who we're going to educate? So here, let's look at this one, underage drinking. So we've looked at what is our local problem. High number of youth have access to alcohol through social sources. What would social sources be? It's a weird phrase. It's one of those phrases that if you see it in a question, you might be like, what the heck? Which is probably what you're thinking now. People they know. Could be parents, could be friends' parents, but it's not businesses. So in this one in particular, so this is the problem. Why is that happening? Underage youth have access to alcohol from their parents in their homes. And so why is that happening here? Basically, it sounds like what they're saying is that the parents don't have education on how to keep things safe. So the strategies to educate parents on social host and liability laws. Who would be the target for this situation?
The social sources.
Right. Like the parents for this one in
Mhm.
particular, parents.
Yeah, for
Yep.
that one, the other parents. Yeah.
Yeah. Who might be some targets of change or agents of change? Sorry. Who might be those people around them? There's not one specific answer. There could be many.
Can you say the question one more time, please?
So if the target is parents or social sources, which in this one we're saying parents, who would be some of those agents of change, the people around the parent that might help them make a better choice?
I'll
That's
say
the right way to
schools,
say it.
schools, churches,
Okay, how could
social organization.
schools, I'm not saying you're wrong, but how could
Mhm.
schools reach the parents?
They used to be called PTA meetings. I think they're called
Okay.
team meetings now.
Okay.
Communications going out,
Okay.
newsletters, things like that.
Mm-hmm. Anything else you can think of? Maybe retailers. So when someone goes into a liquor store, an alcohol selling establishment, um, maybe there's signs up that say, hey, keep your alcohol safe or something like that. So they chose parents as their target. And as you can imagine, looking at underage drinking, there could be a lot of different targets, but they chose parents because they found out that parents is one of the ways kids are getting it. And what they want to see is the number of parents receiving education on social host liability laws. Do you guys know what social host laws are? Anybody describe that?
If you as an adult are hosting a party, you are actually liable for anything that happens there. You're not permitted to serve alcohol to underage drinkers or underage young people. And there are, again, laws that will be that you'll be charged. And, it used to be, they also called it the adults that, parents that, oh gosh,
Hosts
now I
lose
lost.
the most.
Host,
That's
thank
the
you.
campaign. Yeah.
Couldn't find
Yeah.
it. Yeah. Yeah, but there are definitely laws against it and about it. And, it obviously doesn't allow you either to say, hey, throw your keys in the jar and we'll take care of all those things for you. So,
Because, and this is one of my soapboxes that I'm going to jump on for a second. Drinking and driving is not the only consequence of high risk drinking. There's all kinds of other things that can happen even if you don't get behind the wheel of a car. So yes. In Ohio, and different states might be different, but in Ohio, you can provide alcohol to your underage minor child. So I have a 20-year-old. I could provide her with alcohol. If Karen's child came to my house, I could not provide Karen's child with alcohol. That would be one of those social host laws things. But that gets confusing to some people because well, I can give my own kid alcohol. Yeah, I can even write you a letter, but that does not mean you can give my child alcohol. The thing that a lot of people forget is, let's just say all of us here had a party together. We're all, I'm gonna assume, over 21. We let's say I like just pour it on and somebody leaves and gets to an accident, it can come back on me. Um, sometimes that only ends up being a civil, not a criminal case, but there are laws that say that it could come back to me. So social host laws has to do with um, the people who are providing the alcohol to whomever, usually in their homes. All right. Skip over that one. So then they talk about specifically how do you identify the audience? You guys have been really good at figuring out who you might reach out to. Let's look at this one. So the local manifestation of the problem is people using opioids report a lack of knowledge of opioid overdose harm reduction and opioid overdose prevention strategies. Who could be some targets for this?
I think in this case, it's those folks who are using opioids.
Okay.
I think it could also be like the children or young people who might be at high risk for use, that are sort of getting in front of the situation. So rather than those that are currently using, it's those that are at risk, high risk of
be.
using.
Mhm.
And if I
And that's the thing. It could be any of those. Go ahead, Laura.
No, I'm sorry. Go ahead. I was gonna say, if I understand the question correctly, I would say possibly those people who are like a peer-to-peer, like the people who have experienced opioid addictions, things like that, maybe some type of testimonials or relationships type things with those people.
They might be agents of change.
Uh-huh.
Without looking at what's below here, if
Are
we're
you-
just going to say we notice in our community that there's people don't know anything about overdose and overuse, and once we've drilled down to those roots, then we find out that there's a lack of knowledge of opioid overdose risk factors
Mhm.
and how to administer naloxone. So then knowing a little bit more, what might be some targets for that?
Community at large,
Mhm.
for, maybe family and friends of people with substance use issues, challenges,
Mm-hmm.
Mm-hmm.
first responders.
Mm-hmm. Really, they should have what might have been a good situation is when my husband went and picked up my prescription after my sinus surgery, they might have said, hey, you might want to buy some naloxone.
Mm-hmm.
That might have been a good strategy to be to look into this. So yeah, once you drill down, you can get more specific on who the target is.
Mm-hmm. I know in a community where I am, sometimes we'll have educational sessions. The Department of Health will, I think it's called Department of Health. It's on Parsons. They'll come down and we'll just keep the doors open and we'll pass out the naloxone. Yeah,
Mhm.
we'll pass it out. I say it right. Pass it out, but we have to educate them on how to use it, and then they
Mhm.
have to sign a form that they have that who we passed it out to. I have probably about 15 cases in front of me now that in order to give them out though, you have to, to
Right.
educate them. But it's such the community where I am is such a high need for it that sometimes we might go out to the parking lot. We don't go by ourselves because we've had people overdose in the parking lot. We've had,
Sure.
and our security guard didn't know what to do. So we had to keep continuously educate our staff and those who are coming in and out on how to actually use it and how to recognize an overdose, because an
Yeah,
overdose sometimes can look like a seizure. So, or it
absolutely.
can look like another health condition. So we have to make sure that they understand what it looks like.
And one of the things that I think it's important to educate the public on is it's not giving it to someone who's not overdosing is not
Mhm.
going to cause harm.
Right, right, right.
You know how much Meyer is charging naloxone for
Mm.
naloxone,
What is it?
$50.
Oh my
Mhm.
gosh.
I
Tell them just
told him,
come
I
here. I
said,
got
you know, you can get that
cases.
at the health department.
Yeah, like I have
Yeah.
cases and cases. It's unreal.
Yeah.
But we actually, when this first was announced and everybody was so excited about the idea that it could be distributed like that, there were a group of us within our coalition were like, this is not going to end well, at least, or it's not going to start well, because that's exactly what's going to happen. You know, people are going to walk in and, and say, oh, well, geez, that's a lot of money. I'm not going to buy that. Versus, now when, like you say, you can go to public health and get them for free, but people don't know that. And
Right.
yeah, so it's almost like, why do you have to make money on this? Is to keep distributing it, give it out to the community. So it
Right.
was, yeah,
I
that
know. I
whenever
was a
we,
little frustrated when I saw that.
Yeah. It's kind of like
I mean, it's right there on the counter, so it's not like they're hiding it, so that's good. But $50,
Mhm.
$49.95.
Wow.
Yeah. Yeah. Once a preventionist, always a preventionist, right? Even when you go to pick up your medicine.
Exactly.
All right. So they do talk a little bit about how do you figure out more about your audience, focus groups, interviews, surveys, environmental scans. Um, I think we've kind of talked about the nothing about us without us. Going and saying, well, I am a woman, so I know what all women think. Doesn't work like that. I used to be 16, so I know what all 16-year-olds think. Doesn't work like that. So making sure that we are figuring out a way to reach and impact whoever our target audience is. And they talk about, some of the things to look at when you're doing that. Readiness to act. What would that mean?
Are they open to and see this as an issue or see it as something that they're willing to do something about?
Exactly. Yeah. When you're talking about an individual, you might say readiness to act. When you're talking about a community, you might say community readiness. So if you see that term, that's what that means. Let's see, do they have it here? It's not as fun as what used to be. One of the things I like about this is that if you are doing some sort of campaign, create an audience. So, if I want to reach out to parents, maybe I make a couple parent personas. Maybe I say, my parent persona is Katie, and she's a first-time mom. And her husband's name is Austin, and they live in a bigger city, and they've got a almost 2-year-old, and really make that persona. Nobody I know at all, but just in case. And so you can then, when you're looking at what your strategies are, you can kind of focus them a little bit better. You would figure out all this stuff based on your community assessment. So if a big part of your community is young first-time moms, then make that as part of one of your personas. I think it's a way to really think about it a little bit better. So I thought that was an interesting way of doing it. So then we got developing your message. And when you are doing any kind of communication, first thing you want to do is your problem statement. What am I going to be addressing? Why should you even care about this? So, knowing that my target person is a first-time mom, maybe I can say something like, when kids get into school, there's a lot of pressure to do things that might not be healthy for them. And we have this statistic that shows that. As opposed to if my target is store owners, it might be, you know, when young people come into your store, they might try to do something, to buy something they're not supposed to buy. Whatever that problem statement is and why it's important to that person. Then you talk about how you're going to do something about it. One of the ways that we are impacting first-time parents is doing an education program to talk about early prevention with their kids. Then the call to action would be, would you be willing to come and be part of that program? So when you're making up a message, all three of these things really need to be in there. Sometimes I think the things that we do is we might do the first two, but we forget the last one. So I don't know if anybody else has gotten this. But I got this letter from Working America Volunteer. It's just a basic letter. Everyone in my family got one. And it just says, I want to highlight the need for more affordable housing. Many families are finding it increasingly hard. My cousin was forced to move. And that's it. There's no call to action. I have no clue where this came from. I've been doing a little bit of research, but there's no call to action in it. There's no, okay, now what? A lot of people apparently have gotten this letter signed by Katie, whoever this Katie is. Yeah, a lot of people have gotten it. Some people are thinking it might be, if it gets bounced back, that's a way to show that that person no longer lives there. I don't know. But there's no call to action. So we've got to have a call to action. What can I do about this? Then, so they just show you how to set that up. Again, this is now in the folder, so you can see it in there. So when you are creating that message, definitely know your facts. Minimize the cost of the behavior change. What does that mean?
I think you need to be careful of if your change is that you want people to let's think. If you have to buy all kinds of supplies to be able to get people. If you decide that everybody has to start wearing a red shirt, you know, that could be expensive if you have to buy red shirts for everybody. So I think it's taking a look at if we're wanting to achieve a certain outcome, how is that going to be possible? Where can that funding come from? If it's a tangible thing, you know, that was probably a weird analogy, but I guess that was kind of just making sure you know what your cost will be to come to that outcome.
It can also be not physical cost, but if we are saying we want everyone to stop smoking, and you realize that all of your friends smoke, and every time you go hang out with your friends, they're all going to be smoking. One of the costs might be, I might have to get new friends. And we need to think about that when we are creating a message. Or they might say, well, then I guess I don't get a smoke break at work. So thinking about those types of things as well. Emphasizing the similarities between you and your audience, provide a clear step for taking action. So making sure that you've got that call for action, and then repeat the message if necessary. And of course, they talk a little bit about words. You know, don't use words like clean or dirty or addict. We kind of know those. Choose humanizing language. You know, person first language. Tailor your language to the audience. This is where, again, I am no longer 16. I was 16 at a time, but I don't know Skibbity Riz, Ohio, and all of that. That's why you bring in young people to help you craft the message, right? cultural and linguistic competency. And we'll look at the worksheets here later. Then we've got, okay, we've looked at the audience, we've looked at our situation, we've started creating that message, and now we need to implement the strategy. So all the channels that you could do it through, you could do interpersonal communication, outreach and education, mass media campaigns, media relations, social media, non-traditional communication. So being as widespread as you can with the way in which you're going to spread this message. And they go into each one of those. This is not where I would focus on this. All right, let's talk about each one of these, and you can click on the links. Finally, we're going to evaluate. How did we do? Always want to do evaluation because that helps us figure out what we might need to change for next time, right? Some of the ways to evaluate your communication efforts. Have you gotten requests for materials? So Prevention First asked me a lot of details about the doctor they were going to send the stuff to because they want to have that information as part of their evaluation. How many people came to an event that you might have done? Your web visitors, your Google Analytics. I've had to learn some of those terms. Social media, checking how many likes you got, how many views you got, how many shares, and then any other stories that you may have seen based on what you did. How many volunteers have you got? So do we have people who are taking that next step and taking that call to action? Or people wanting to maybe give you money, give you resources, give you some kind of capacity? They talk about, different things you can use to do analytics and do any kind of evaluation, how you can ask some of the questions. Evaluating and reevaluating your message, always testing it with the target population. And then I'll show you some of these worksheets. I really do think that some of these worksheets would be beneficial if you're working on something. So, maybe you've got 3 different strategies and you want to try to figure out which one would work. Can give you some ideas on what that might look like. This one is the, making that person that you want to reach out to. So who is your intended audience? Are they a target of change or the agent of change? What are some things about that person? How does that person receive information? Because we know that young people do not do newspapers. And we know, older people may not do all the social media. Just really building out what that person might be. This is where you can go through and help develop your message, which I think is really kind of cool. And then the whole strategy, and then the evaluation piece. So this, like I said, this is going to be in the folder. So you can go back in and look at it. I'm really sad that it's no longer the toolkit. Who knows? Maybe there's just something going on. I don't know. But questions about the communication toolkit? Okay. One huge thing that we're going to talk about in this one. They do talk a little bit, and again, this is one of the pages that they talk about looking at the cultural linguistic specifics to whatever group you're reaching out to. Like we said, not all groups receive information from the same source. I I don't know that I've picked up a newspaper in probably 15 years. So really, unless you're looking at maybe grandparents or business people, I know, Jayla, I've for half an hour, I was searching for it. I was really sad.
So I was so confused.
I know. I looked everywhere for it. So making sure that we know how our group receives information, whether that's a cultural thing, an age thing, a gender thing. And not all groups use social media in the same way. That's very important to understand. All right. This part here, I will give you, I don't know, 25 bucks if there's not a question on the test about this, because there's always been a question on the test about this. The 4 P's of marketing. We're going to go through each one of these, but they are product, price, place, and promotion. And the way in which Coca-Cola might do it is really the same way, just with little switches. The product would be Coca-Cola. The price might be $2.50 a bottle. The place might be in convenience stores, gas stations, wherever. And yes, they probably are the same ones. And then the promotion might be we're going to promote it along with the 4th of July or whatever might be coming up. So let's look at these specifically for our behavioral health issues. So the product would be, what do we want people to do? What is the behavior that we want to happen? So whether that's to choose to make healthy choices, whether that's to stop doing something or start doing something, that's the product. What it is, what's the behavior that we want to happen? I put this little set of pictures down here. These are the strategy or the products for being healthy: to get sleep, breathe, eat healthy, drink water, be fit. That's the product that we're looking at. The price, again, is how much is it going to cost a person to stop or start a certain behavior? So it might be that you get made fun of by your friends. It might be that you have to make new friends. It might be that you have to move. I know that sounds drastic, but sometimes that's the case. Whatever that is, we need to know what that is for our target person, because we need to be able to address that. So if we're looking at a young person and telling them they need to make healthy choices, we need to think about what's that going to do to them with the people that they're with. They kind of allude to, if we want people to clean up trash, price might be, what am I going to do? How am I going to find a trash can? So to reduce the price, we would put more trash cans out. Please stop me if I'm going too fast. The place. How difficult is it to change the behavior? What are some of the barriers? If you are trying to sell, well, they say jeans, and you only have them in one store, it's not going to be able to sell very well. So if your behavior is you want people to clean up trash, we need to have signs everywhere about that. We need to have garbage cans everywhere about that. We need to make sure that people know everywhere about that behavior change. So making sure that, and that's why doing things through social media, online, gets it out to more of those places. Promotion is how do we basically market it? Are we going to connect it with an event coming up? So I know place I used to work, we did a lot of prom and graduation stuff, helping people make good choices during that time of year, because that's an important, or that's one of the times we see an increase in drinking in young people. Maybe talking about smoking during pregnancy, maybe you'll put things in a obstetrician's office. So where are we promoting this? So just a reminder, product, price, place, and promotion. I'm telling you right now, there's going to be a question that's either going to say something like product, price, place, and what other P are part of the 4 Ps. Or it might say the cost or barriers the audience faces in adopting the desired behavior is an example of. So this would be one of those things I would definitely check on and focus on. Everybody who's come back, and I'll be interested. Heather, you're taking yours on what day? 12th?
12th or the 14th. It's on a Tuesday.
12th. You got to let us know if it was on there, because I've always heard there's some kind of question about the 4 Ps on there. And yes, Heather, I will give you $25 if it's not on there.
Yay. No, I was just going to say, one of the things, there's a lot of language in there about like, you're not allowed to share the questions and stuff. I'm sure I could say like that there was one on there, but you're not really supposed to
No.
say.
Exactly. No, you're not going to tell us the exact question.
Don't get me in trouble.
You're not going to tell us the exact question. You're just going to say, yes, there is something about the 4 Ps. All right. Some of this is, reliving, reseeing what we've seen before. They talk about doing a SWOT analysis. I know we've kind of talked about this before, but looking at what are some of the strengths in the community. What are some of the good things that we have going on? What are some of the campaigns that have done really well? What are some of the weaknesses or barriers that are coming up? So maybe we have, new dispensaries in town, or a new festival has started up. What are the opportunities? So you can look at some of those barriers and say, well, maybe that could be an opportunity. And then the threats and challenges. We also talked about this before. Just wanted to pull that up since it was in there. The different ways to write a SMART objective. So they also kind of talk about what kind of media, just because it's print media doesn't mean it has to be a newspaper. Like this Mason and Deerfield lifestyle, I always laugh because at my old house, we never got it. I didn't even know it was existed. And then when we moved to our new neighborhood, I started getting it, and opened up on the inside. It said for Mason and Deerfield townships, higher end neighborhoods, which this neighborhood is not by any means a higher end neighborhood. But I think it's interesting to just look and see what kind of things in your area might be given out to people, because I actually do read this. Newspapers, I don't know. Do people still get magazines? I get them on occasion. Only if there's
Yeah, I
something
get a
really
lot
good.
I get a lot of like what are they called? Like the Reach magazines?
Oh, like for coupons? I'm
Yeah.
talking about just like magazines that you would sit down and read.
Oh no, I don't.
I either have to buy them or I have to order them. I have this app, it's Fetch. If you get so many points, they automatically just let you pick a few magazines. So it's usually
Oh, okay.
something that I never look at. So travel magazines are places I never go. So
Right.
yeah, I get those. Yeah.
I saw an article recently that the most widely distributed magazine is the Costco connection.
I get that. I get
Yeah.
that. And it, because it does
Thank
have
you.
articles in it. It's not just about, I also get the AARP one. Yes, I do. Just so you know, you don't have to be over 50 to get AARP magazine. And there's lots of good articles in it, but there's also good, um, what's the word I'm looking for? Percentages off things. So yes, Jayla, even you could get AARP. All right. Couple other things looking at some of the new or um, what when this was written would be considered non-traditional. I think nowadays it's become more traditional. But think about, do we want to do a blog or a podcast? Um, I kind of laugh when it says it has Facebook on here because that to me seems so old nowadays. I would say, TikTok or something, but look at some of the new places that you can get your message out. I put in this just because I think it's something to read through. Um, I I wouldn't focus on it too much, but look what else was in there. The 4 Ps. So make sure that we know that. This one talks about what are some of the things to evaluate to make sure that your everything you've written and everything you've done is effective. If you, let's say you are making something to go out to the media, what do you want to have? Making a one pager. So let's say that you've just had this huge event and you want to people to know about it. One pager fact sheet, maybe a background sheet. And remember who your audience is. So if you're writing this for the media, they don't know our stuff. So making it very specific, maybe some story ideas, including maybe some people who might be willing to talk. And then what are some news clippings, some things that you might have already had news about. I was working with a community one time and she was having and this is a little bit different, but she was having a advertising company come up with some of their communication, and she created a notebook that talked about what their assessment plan was, some ideas that had worked in other communities, some basic prevention principles, and it made her campaign so much richer and more effective. So doing that pre-work really can be helpful. I think this was in another one of our things, but just kind of understanding the stages of change, understanding that, community can be in a particular place, but also individuals within that community, pockets within that community. So there's not going to be a question, put this in order, because remember, it's all multiple choice. But there might be something that talks about stages of change. It's, your community is in the pre-contemplation stage of change. Which of the following might be a good strategy? So it might be that kind of thing. I had to giggle again because this just shows how old some of these documents are. What is social marketing and what is not? It's not a one approach model. All right, not that I want to speed through anything, but some of these things are things we've already talked about. Finding out real specifics about your audience. Again, I love the idea of creating fake person. Making sure that your message, and again, this to me can be fixed almost wholeheartedly by taking it to the people and saying, what do you guys think about this? Again, I'm nowhere near as cool as I used to be at 16, and I wasn't cool then either. So making sure that, 16-year-olds of today think it's a good message. Bring in those experts in media relations. This is why it's so important to have somebody from the media in our coalition. Um, collaborate, collaborate. This is why we have all of these sectors so that, somebody who is really good at business might be able to help us reach a business community, or, somebody who is in the state or tribal government might be really good at learning how to craft a policy. Um, I love this kind of way of looking at it. So when we want to reach out to people, we want to first start with, we want to see people who have no involvement. Then we want to kind of network. Then there's cooperation, coordination, and then collaboration. You're not going to jump in and all of a sudden be in collaborating. Maybe you've got some people who are just there for networking. You can try to move them further. But it's okay for people to be in any of these stages. When we are getting our message out, this is what we're trying to do. We're trying to start with, let's just get knowledge out. A lot of times when we do evaluations, we are just evaluating, did that person learn anything? But that's great, but it's not going to show these next two steps. The next one would be, is your attitude changed about it? Do you think differently about this situation? Do you see things in a different way? And then finally, we want to make sure, is there behavior change? So, we always start with, yes, we're going to increase the person's knowledge about the dangers of drugs and alcohol. Increasing their knowledge is just one step. We have to say, are they changing their attitudes and maybe their intentions? Maybe they're looking at, I want to do things differently. That's a little bit harder to evaluate. And then, of course, behaviors is one of those long-term things, which, it's a little harder to test, to evaluate, but that's really where we want ultimately is the behavior change. All right, let's do some questions. These questions I just pulled this morning are from the Kahoots. These are the ones that were most missed. So in selecting a prevention program, what should you do? So what do you see in that question? What does that question say to you?
But you're looking at selecting something, you're making a choice, you're at the beginning of the process.
Okay, yeah.
And then the what should you do is basically based on the best practices that you've learned, like what should influence your choice.
Very good. All right, so let's look at our possible answers. Select the program with community input. Base decision on what other programs, prevention programs are doing. Base your selection on the prevention literature, or select a universal-based approach. Any questions on what any of these mean? Okay. So let's start at the bottom there. Select a universal approach. What would that look like?
This would be something that wasn't necessarily tailored to the indicated or the selective group. This would be something that could be used for the entire community. So yeah, so we could do it in the entire school, not just in the class where students are struggling because of behavior or something.
Okay. What about base selection on the prevention literature? What would that mean?
You're looking at the research and what the evidence base says is an effective program.
Okay. Is that what you were going to say, Laura?
Yes, I was going to say that, and it's for a specified community. So
okay. Base decision on what other prevention programs are doing. What would that mean?
just means it's actually a little bit of research if it's people in your area, but if it's, you can see what's working, what's not working, if they're in your area, but also it's ineffective because what's working for them may not work for you. So-
You took another step there. Yeah.
Oh, sorry.
No, that was good. And then select the program with community input. What would that mean?
Nothing about us without us.
So is there any of these that you're kind of leaning more towards?
I think both A and C make sense. I probably in this one would say A. I mean,
Because
but
why?
I think it's a poorly written question. Because you do want to select your strategies based on what you know works or what the research says works, but I think that even if something in the literature says that it works, if your community doesn't provide input, then it's not going to work. Would
I
be my
would, yeah, I would probably write this question saying, what would be maybe the final step or the
most
last
important
thing? Yeah,
or
maybe
the
something
most,
like that.
yeah.
Because yeah, it would be A. Um, because I think, Laura might have said it, just looking at what other people are doing or what the literature says, that may not mean anything to what your community wants and needs. Now, to Heather's point, yeah, I'm not going to just go into the community and maybe the community says we need to, have scare tactics all through the city. Well, that's not going to be the most effective. But again, we're going through these questions that are kind of harder. So, all right, example of an evidence-based environmental approach to substance abuse prevention is, so what are some things we see in that question?
I see when it says an example, it's not, maybe not an actual study that they've done because it says evidence-based environmental approach. So it's just an example of one.
Okay. What's an environmental approach?
We're looking at creating community change or system change in the process of utilizing this type of prevention.
Okay. So if you kind of think back to your CSAP strategies, environmental, basically trying to change the environment, some kind of system change to help people make better choices. So let's see which one of these it might be. So we've got a school-based curriculum highlighting community risks, programs serving student dropouts, community health fairs, or server intervention training. So school-based curriculum highlighting community risk, is that an environmental approach? What approach would that be? It's another E.
Education.
Yeah. Yeah. So here's one of those things where all of these things might be effective and might be good, but that one does not match with the question. Program serving student dropouts. Would that be an environmental approach? No. Again, it would be maybe something that might be effective in substance abuse prevention, but it's not matching the question. Community health fairs.
Information dissemination.
Mm.
Yeah. So that's just giving out information. Again, a good strategy, but that's not environmental approaches. Server intervention training. Is that an environmental approach?
It is trying to by training. Oh, sorry, Laura, go ahead.
No, you go ahead.
The training is, while it's intended for a group of people, it's trying to target changing the environment within the setting of the facility wherever they're being trained at.
Yeah, I said this is the one
Changing
that always
conditions.
confused me because I thought, well, training, that's education. But it's basically training the environment, changing the environment. So, oops.
I have a
So
quick
that would,
question for you
yeah,
about that one.
yeah.
So when we're looking at the target and the agents, how would you answer the question for that term, that particular one? Who's the
So
target and who's the agents of change?
the target, we want to, I think it would depend on how you wrote your question, your problem statement. So if you wrote your problem statement that people are getting into problems because they are being served too much alcohol,
Mhm.
then the target would be the server. If the problem is that, let's see, how could we make it so that that people are ordering high quantity alcohol drinks, then that would be the individual person drinking.
Okay. And then the agent of change then would be provider that would be doing the training. Perhaps.
It can be, yeah,
Right?
yeah, that could be one of them. Yeah.
Okay. I just needed to kind of
No,
toss
that's
that
good.
into that kind of a
Yeah,
situation.
no, that was good. All right. An example of an indicated prevention strategy. So what does that mean?
So indicated, we're looking at focusing on a specific group that's at risk.
That may have already been participating in the risky behavior. As opposed to selective, which would be they have a risk factor. So we're looking at something for the group that's already kind of started to dabble. So we've got media campaigns, school assemblies, student assistant programs, or social norm campaign. What's a social norm campaign? Go
Did
ahead,
you
Karen.
sort of an opportunity to kind of establish what the norms are, that the norms are not that every teenager drinks, that not every celebrity parties with, whatever.
Diddy.
So,
Yeah.
and not every opportunity to sit on the beach needs to have, Corona. So
Exactly.
it's kind of just trying to establish that, debunking sometimes, but then also even just giving a good visual of this is kind of what we believe here.
Yeah. So when I was working with a coalition, we created water bottles for all the kids at the junior high that said, I think it was 88% of students at X junior high don't vape, be part of the majority. Just showing that, it's normal to not do it. So would that be an indicated prevention strategy? No, that's more of a universal. Media campaign would probably be more universal. School assembly, more universal. What's a student assistant program? Assistance.
I used to live in Pennsylvania when they were establishing SAP programs, and we were working on this. It's basically training individuals within the school setting, the system, the school nurse, the guidance counselor, teachers. We even used to bring in, the cafeteria workers, and we're training them basically to understand risks and protective factors and kind of identifying behaviors. And then that team works together to try to help intervene and provide support services to youth and families.
So when we look at this question, that's the only one that would fit. Does that make sense to everybody? All right, this is probably the hardest one. Maybe you guys will get it right off, but according to the social development strategy, one of the conditions necessary to build bonding is to, now let's pretend like we don't even know, and you may not know what the social development strategy is, okay? Some other things in that question, build bonding. So we know it's whatever it is we want to build bonding, and we can kind of figure the social part of it has to do with bonding with people, okay? I just wanted to kind of show you how you could figure this out, even if you didn't know what the social development strategy is. Development usually has to do with, people who are developing, which would be youth or young people. So let's see if we can figure this out without knowing all of the question. Provide opportunities for youth to contribute to their communities. Provide info on drugs and their effect on adolescent brain development. Invite guest speakers from law enforcement and criminal justice, or discuss community attitudes towards substance use misuse among youth. Are any of these ways that you could build bonding?
My first thought was either A for me, provide
Okay.
opportunities for you to contribute to their communities.
Okay. Anybody have another thought? Let's pretend like it is A. Does discussing community attitudes towards use, does that, I mean, there might be some bonding, but
I was like, yeah,
Nora?
you're not really bonding anything or anyone together.
That sounds like
Okay.
that's more parents telling you what to do and what not to do.
Okay. Inviting guest speakers from law enforcement and criminal justice.
No.
Almost think that's going to be kind of the opposite.
Yeah, I was just about to say that. I think it's kind of the opposite.
Provide info on drugs and their effects on adolescent brain development.
No.
That sounds like the two eggs, your brain on drugs when they put
Right.
them on the pan. That's what it sounds like.
So then providing opportunities for youth to contribute to their communities. Is that building bonding? Is that building social bonding? Because we're specifically talking about youth and the communities.
Yeah.
Yeah.
Youth like to contribute. Yeah. Youth
Yeah.
do want to be heard. So
So even if you don't have a clue what that means, you can go through it just like we just did to kind of figure out the answer. Questions on that one? All right. Next week is the last week. That is I just put in the chat the link to the folder, but again, I will email it out to everyone. I think one of probably the biggest things is this test taking tips and tricks, because you guys know the stuff. I'm going to say something, and yes, I'm going to say it on recording, but I'm going to say it anyways. You guys have probably been one of the most knowledgeable groups. I think part of that's because we've had so many OCAM trainings over the last, 5 or 6 years. But you guys know this information. It's going to be, how do we take a test the way that they're going to give the test? So that's going to be one of the biggest pieces. And we will go through a lot test taking tips and tricks. Questions between now and then? All right. I'm going to